This conference will now be recorded.
Hi, everyone, and welcome to the AnCan High Risk, Recurrent, and Advanced Prostate Cancer video chat for Monday, August 19, 2024. I'm Len Sierra. I'll be moderating today with a little help from my fellow moderators and all of the attendees here. We want to acknowledge our sponsors before we get started, and they are Bayer, J&J, Myriad Genetics, Novartis, Telix, and Blue Earth Diagnostics. So, David OPP, you are new, and therefore we start with you. Were you referred by Jim Marshall?
I happened to catch one of your recordings on YouTube, and that's how I found out about you.
Oh, okay. So, David, is that your last name, OPP?
Up.
Yep.
Just
Okay.
say up is how it's pronounced.
Right. Okay. And how old are you, David?
I am 70 years old. Just turned that today.
Oh, happy birthday.
Happy
birthday!
So, David, where do you live?
I'm in north central South Dakota.
South Dakota. Wow. That could be our first from South Dakota, right, Rick?
Could be.
So you heard about us from YouTube.
Yes.
And so, David, what is your Gleason score and what was your PSA at the time of your diagnosis, and when were you diagnosed?
I was diagnosed in February of 2016. I had a PSA of 85, and my Gleason score was 3+4.
Huh, that's a pretty high PSA for a favorable intermediate, so-called. Okay, so what did you do after you had your diagnosis? Who did you have? What was your primary treatment? Was it surgery, radiation, and where did you go for it?
I chose surgery, and I had surgery at the Mayo Clinic in Rochester in September of 2016. And at that time, at the diagnosis, they did not find any spread. But at the surgery, there was spread to both seminal vesicles and to 3 of 23 lymph nodes that were removed.
Okay. And what happened after that? How did your PSA respond to that?
The 3-month PSA was undetectable, but at 6 months it had risen to 0.33. And I was referred back to the Mayo Clinic at that time, and their decision was to do IMRT locally, about 75 miles from where I live.
Okay. I guess that's local in South Dakota.
Yes.
So, so you had IMRT. How many sessions? How many gray? Do you know any of those?
Yes, we did 33 sessions. It was a total of 66 gray. And I was placed on ADT for 12 months.
All right. And now we're in what, 2017?
Yeah. The salvage radiation was done in 2017.
Yeah. Okay, and then post-radiation, how did their PSA respond?
PSA was undetectable until like July of 2019. It had started rising. It was point, I think earlier it was 0.12, then it had gone up to 0.93. At that stage, I was referred to Dr. Kwon at the Mayo Clinic in Rochester, and he took over management of my cancer.
So I'm sorry, I didn't catch the year. You said July of some year, your PSA rose to 0.9. What year was that?
2019.
19. Okay. And so when did you see Dr. Kwon?
In
That same
July
month?
of
In
that
July.
year.
Okay. And what did he have to say?
They found the choline C11 scan, found one bone met on the upper humerus on the right shoulder.
And that's it?
At that time, that was it. His treatment plan was to do 10 sessions of spot radiation for a total of 30 grays done locally in South Dakota.
Just for that spot on the humerus.
Yes.
And so you had that done in 2019?
Yes. And 2020 scan at Mayo found one more bone met and 2 lymph node mets. So Dr. Kwon's recommendation was to do 6 cycles of Taxotere chemo, and I was supposed to do 36 months of ADT. I stopped the ADT at 21 months.
That's still pretty good. Okay, so what year are we in now? 2021?
Yes, that was 2021 when I did the chemo. I was like a week after the last chemo session, I returned to Mayo for a scan and blood work, and at that time, there was no evidence of disease.
Okay, so that's following the Taxotere and the ADT.
Yes.
At any point, did you have any genetic or genomic testing done?
I had done, I can't remember the name of the study. It was a saliva test, and that came back with no mutations.
Was it PROMIS?
Yes.
Okay. What about somatic testing of the tumor tissue? Was that ever done?
No, that was never done.
Okay. Okay, so you're undetectable at what point now? Or what time?
This was, say, July of 2021 when I became undetectable, and that lasted for 2 years until July of 2023, when I had my PSA at that time was 0.55.
When had you completed your 21 months of ADT?
Would have been November of 2022.
Okay. And so you were you were on a drug holiday from November 2022 to July 2023, where your PSA was slowly creeping up to 0.55.
Yes. Yeah.
Right.
In April or March PSA in 2023. No, 2022 would have been less than 0.1, and by July of that year, it had risen to 0.55.
Okay, and so what was done next?
We were slowly watching it, and it was nearly doubling in about 5 years span. We were doing PSAs monthly at that time.
It was doubling how often?
Basically every 5 weeks.
5 weeks, okay. So what did
It,
Kwon do?
we did a C11 scan in October of 22. I had a PSA of 2.6 at that time, and they found 2 bone mets. One was on the L4 vertebrae, and the other was in the
Hold on a second. Hold on a second. October of 22 or October of 23?
22. I think I was a year off back about a year and a half ago.
But you said that you were NED from 721 to 723.
Yeah, that should have been 722. Sorry.
You fooled me. You fooled me. I was paying attention there, Mr. Up. Okay, so you were NED from 721 to 722, but
Or
you
7 2020.
okay, from 720 to 722 you were NED. Well, NED meaning you didn't have a PSA. It's not really NED, but you didn't have a PSA. And then
I was getting scans every 3 to 4 months. So there was nothing showing on any of the scans.
okay, so between July 22 and November of 22, you started doubling like crazy, and Kwon did another C11 because PSMA is not in his vocabulary, I don't think. Is that right?
It was a C11, but he did go to PSMA.
Right. It takes him a little while to cotton on.
And the October of 22 scan found a bone met in the L4 vertebrae and on the iliac bone. And his treatment plan was to come back to Mayo and do 1 round of SBRT at 20 grays to those 2 bone mets.
Disbarred or whatever.
That was October 23?
October of 22 that we did. The PSA was rising, and we did the treatment in December of 2022.
Okay, and how did that work?
Worked excellent. I went back in February of 2023, and we did a PSMA scan at that time, and the 2 treated mets were completely gone. However, we found 18 scattered bone mets on the PSMA scan.
18?
Yes.
Wow.
That's a tree rock.
So, in his words, my cancer had really caught on fire.
And he still hadn't ordered any genomic testing?
Not at that time, no. He still had.
And I have another question. At any time, had you been on a what we now call an ARSI, an androgen receptor signaling inhibitor, like abiraterone or enzalutamide? Because I haven't heard you mention that, darolutamide. Had you ever been on one of those?
not until February of 2023. Dr. Kwon's treatment plan was to restart Eligard, and he added abiraterone with prednisone at that time.
He makes me nuts.
And are you still on that now?
Yes.
And have you had a scan since that time?
Oh, yeah, we do scans every 3 months.
So how's the scan looking now?
There are probably 2 or 3 spots that just show a residual uptake of the gallium tracer. And PSA went from 6.2 in February. By April, it had dropped to less than 0.1.
No shit.
So I generally respond very quickly, PSA-wise, to the ADT.
Yeah.
Right. So is that where you are now, 0.1 or under 0.1?
Yes.
And you're
Yes.
still on Abby.
We did reduce the abiraterone dosage 6 months ago to half, to 500 milligrams, because of
Is that
side
because
effects.
because of fatigue?
Fatigue, dry mouth, shortness of breath.
Okay. Have you been exercising through this long ordeal?
Yes, I'm a active farmer, rancher,
Very
so
good.
I get exercise, and there for a while I was traveling to meet with a personal trainer at a CrossFit academy
Okay. Well,
twice a week.
Oh, terrific.
that's exercise. You know, we have so many people who think that they exercise doing their work, but the problem is that when you exercise through the course of your work, even if you are a rancher, you don't sustain your heart rate at a high enough level for long enough, because you'll pause if you get out of breath or what have you. And the sort
Yeah.
of exercise that you've got to do is what you did with your trainer. You know, this is for everybody. And for anybody who listens, don't think that you get your exercise through doing your gardening, through doing your work. It will be appropriate after we're done with you to talk about somebody we just lost this week. And their argument was, well, I get it through doing the gardening. Well, they don't. And it's so important. Jimmy's not on today, but it's so important that you make an effort and cut out some time to do your exercise. Isn't that right, Len?
Absolutely. What about family history, David? Anybody in the family have prostate cancer, or on the woman's side, breast cancer, ovarian cancer, pancreatic, anything like that?
I have an older brother that had prostate cancer surgery about 13 years ago. And since his surgery, he's been undetectable.
Okay, that's the only other cancer.
That I know of, yes.
So, do you have any questions for the group?
Not overly. I'm just kind of more interested in hearing what's going on. I am part of another Zoom group meeting that meets every Wednesday.
Is that an us2 group?
Prostate Cancer Warriors group.
In South Dakota?
It's a Zoom group from the whole U.S. We don't meet in person.
Right. Who leads that group?
Dennis Finnegan.
Okay. Do you know him, Rick?
I know of him, yeah.
Okay.
Is that group with people of all different types of prostate cancer, or is it just for people with with high risk recurrent and advanced, David?
It's for all groups, even newly diagnosed
Yeah.
to
Yeah.
advanced
Yeah.
on it. We've had treatments where members have gone through Pluvicto
Right.
and
So David, let me because I'm, as Len knows, it's hard for me to control myself when I hear this. And I'm serious, but I have no problem. The best thing you can do for yourself right now is get yourself out from under Kwon. We had another gent who patently refused to do it. He was not treated right. It is unbelievable to me, unbelievable that with your history, you never were put on a second line anti-androgen until 23. It's outrageous. Outrageous. Now, I don't know what the other group says, but I know if it were me, and given that you want the longest life you can get, you've got to move your treatment. If you like Mayo, shift over to Dr. Sartor, Oliver Sartor. He's one of
yes,
the
I've
best.
heard of him.
He's one of the best GU medical oncologists in the country. Some people are saying he's not taking patients. I think we could get him in, but that is a real option. But Dr. Kwon is not a medical oncologist. He's a surgeon, and he treats
Yes.
like a surgeon. And I can't tell you, I've been doing this since 2007, and I cannot tell you how many people I have spoken to who have been Kwon patients and who have had the type of treatment you've had, and it's not been successful. Now, I don't want to go back and say, well, if they did this, it could have been that. But I can tell you that the standard of care would have been to put you on an ARSI a lot earlier, and you probably would have had I don't want to say probably, but you would have had a good chance of getting intermittent therapy like many of the guys in this group. Now we don't know when we can get you off. And it leaves me speechless. So the best thing I can possibly say to you, if you'd consider it, is to move your care to a GU medical oncologist. And we can give you a whole number of names, but if you want to stay at Mayo, the best person there to see is Dr. Sartor. And there's it's not easy to move from Dr. Kwon to Dr. Sartor. Dr. Kwon doesn't make it easy, but we can get it accomplished if that's what you want.
Okay. Well, the one time that I was somewhat disappointed in Kwon's treatment is when the 18 bone mets were discovered. He simply went with ADT and an ARPI. He did not add chemo to that as a triple treatment.
Yeah, but you've done chemo. The problem is he should have, when you back in whenever it was when you had that met in your right shoulder back in the day, he should have put you on abiraterone, but he never did. And what happened is, where did that go? Well, you did the 6 cycles of chemo in 2021. He put you on ADT again, and he still didn't put you on abiraterone. No shit. What happens? You got 18 mets. I mean, I don't know where this thinking comes from. It's not standard of practice. You can go look at NCCN. You can go look at the ASCO. You can go look at a whole bunch of guidelines. He doesn't follow standard of practice, and his patients suffer, but his patients love him, and they don't move away. And we sit here wringing our hands, and at this point in time, you're not getting optimal care. I mean, if he could have put you back, I mean, I think other doctors at that point in time, they might have added Jeff Tanner at that point in time. But the fact is, if you would have been on the abiraterone earlier on, the disease would have had a different course of treatment.
Okay.
this is when it comes to treating advanced disease at Mayo, they have been lacking for years, and they hired Dr. Sartor about a year ago last February, a year ago last April. He started, and he had to go up there with a hard hat because of the internal politics. But at least they have a really good doctor there. This is publicly recorded. I have no problem in talking to Dr. Kwon about these ridiculous treatments that he invents. Why? Because we've lost 2 or 3 guys who were with Dr. Kwon because he followed these treatments. And it makes me personally nuts. And as AnCan, all we can do is navigate you and support you. But every man who is in this group, we navigate to a GU medical oncologist if they have advanced disease, not to a urologist, not to Neil Shaw, not to Eugene Kwon, however good they think they are. And I can't be more forthright in this. It just upsets me because I don't think you should be in the situation you are. Now you are. We've got to figure out what to do. Dr. Sartor would be a very good person to help you out. If you want to go to Chicago, if you want to go to Houston, if you want to go somewhere else, we've got other names that we can send you to. But please get yourself out from under a urologist. A urologist does not know how to take care of advanced disease. Period, paragraph.
Okay. Yet, when you read about Kwon, he's got this reputation of being very aggressive.
Yes, he's also got a silver tongue. And if you go listen to him at PCRI, everybody thinks that he's the best thing since sliced bread. But if you've been in this group for years and followed this group, we've seen too many people who have not been treated right. I mean, C11 scans, they should be consigned to the ARC. He should have been doing PSMA scans back in 20s when some of our guys were getting them. There are probably guys here in this group who got PSMA scans. No, he didn't believe in them. So he can't treat. He doesn't treat right. He doesn't treat according to how extensive your Mets are. But enough. I don't want to. I've made my point. How can we help you now?
Okay.
And Dr. Jeff had his hand up. Dr. Jeff, what was on your mind?
Just wanted to ask, you said you were going to be on scheduled 36 months of, was that Eligard you were going to be on?
The Eligard and the abiraterone.
But I thought that you said you stopped treatment after 21 months.
This was right after during the chemo sessions. It was just Eligard, and we did 21 months.
Right.
Of a 36
and then they
month
restarted.
cycle.
And they restarted the Abbey and the Eligard in February of 23, Dr. Jeff.
But why did you stop? I get it that it was just ADT, but what made you stop it 15 months before it was supposed to?
Side effects were causing issues.
Okay, but you're back on the Eligard again, right?
Yes.
And this time with Abby, and are your side effects came back or?
Yeah, I'm battling the fatigue. I meet with a psychiatrist. We tried Ritalin for a while and for 5 months, and that did not do anything. We switched 2-3 months ago to Adderall at 10 milligrams, and that has made somewhat of a difference.
So a couple of things you can think about. I mean, if you get anywhere with Kwon, you'll be lucky. But a couple of things you can think about if it's happening. You can talk to him about monotherapy abiraterone. Could
Okay.
work. We've seen it work with other gents. You could talk to him about switching from Abi to darolutamide and monotherapy darolutamide. That could also work. We've
Okay.
got several guys in the group right now who are on monotherapy darolutamide. But I sort of get the feeling that he does not he doesn't subscribe to those protocols. But we have some very, very good GU medoncs who do prescribe that way, like Dr. O, Dr. Evstathiou, Dr. Shmulewitz. We personally think here at AnCan it's the wave of the future. We think more and more docs will move to a monotherapy, whether it's abiraterone, enzalutamide, apalutamide, or darolutamide.
Well, I did, back when I did the Taxotere chemo and the ADT, I had a good response, and 2 years of undetectable at that time. Maybe I shouldn't have stopped the ADT.
It's hard for it depends how you measure good response.
Yeah.
Were you being was the time after the 1122, between 1122 and 223, how many times were you scanned?
Just once. I mean,
That's
February of 23, and it would have been October of 22.
right. So did you have a good response? Well, you didn't show a PSA, but in the meantime, you were building 18 Mets. So why wasn't Kwon scanning you in the interim? I mean, we cannot rely that. And the other thing is that maybe that tells us that you have an unusual type of prostate cancer where the Mets build up without showing PSA, and we need to sequence you. I mean, the fact is you've never been sequenced, which is also a scandal, because that's again contra to the standard of care, which is in the NCCN and the AU and the AUA guidelines, and that might identify you for a particular type of treatment. But these things will go by the wayside. I mean, I can tell you that if you go see Dr. Sardor, first thing he's going to do is order sequencing.
Okay.
In your first visit, he'll say to you, yeah, we've got to get your sequence. We've got to see what's going on here. Anybody else want to say anything? Because we've spent quite a bit of time now with David.
Yeah, well, fortunately, Rick, we don't have many guys who need time tonight, so it's
Okay, great.
But is it all right with you, David, if we move on, or do you have anything else you want to discuss?
Not really, but I have an appointment in 10 days with Dr. Kwon again. We're going to do another scan. And, I can push or demand that he do a sequencing at that time, and see what they can find.
Yeah, the problem is that
Well, if you're going to stay with Kwon,
if he finds something with Kwon, you don't know if he's going to respond to it.
Yeah.
And so, the more important thing is to get yourself to a doctor who's going to do sequencing and who we know will respond to it. I mean, we've seen what Kwon does. Why should you, as the patient, be pushing for sequencing when it's in the guidelines? It's in the guidelines. Metastatic, you got a sequence.
Yeah, and in one of his PCRI videos, he made a statement that anytime a treatment plan fails, he resequences the patients, which he's never done for me.
Did he say resequence or rescan?
Or no, resequence, do another genomic.
Yeah. Well, yeah, that is weird, the why he never did it with you.
The best thing you could do for yourself
Yeah,
is scrub that appointment with him and try and get an appointment with Dr. Sartor as soon as you can at Mayo if you want to keep your treatment at Mayo, if it's convenient
Okay.
for you.
They're difficult to get into, both of them. You're basically at a 3-month wait generally to
Well,
get in.
I think I think that if you write to Sartor and tell him that you've been with him, you're not happy with your treatment, and you're an AnCan person, you might get in quicker. The other person to consider is Dr. Antanarakis in Minneapolis
Okay.
at Masonic.
Okay.
Alfredo, you have a question.
I was just going to comment. I think I'm going to lean on Len and Rick. I wonder if a topic for another time, not a whole evening, but a topic for a few minutes, is the whole subject of people switching doctors. So, full disclosure, I'm a retired internist, and if I look back on my practice, many cases were not really about me and the patient or me and the family. They were about the patient or the family sensing that something wasn't right with their care. And this is a rich and complicated topic.
Yeah.
And so I was just, wondering if it comes up. It probably comes up in this group pretty often. I'm a newbie. And it might be worthy of some minutes of discussion at some future date. That's all.
Yeah,
Okay.
we have talked about it many times, Dr. Alfredo, and we are definitely always willing to discuss it. As you well know, it gets very tricky if you're switching within the same practice. But I
Oh, yeah.
think any advanced prostate cancer patient is entitled to be seen by a GU medical oncologist.
Yes, I agree. It's just an interesting sort of psychosocial phenomenon for many reasons. People are much more willing to switch retailers for whatever product you can name than they are to switch, medical systems or even individual doctors. And yet,
Absolutely.
doctors are not infallible. The Mayo Clinic is great, but not infallible. UCSF and UCLA, where I trained, are great, but not infallible. And it's a
Agreed.
difficult thing. And I just reflect on my practice in my retired years. I get phone calls all the time from patients and families questioning their care. And, my role is to listen and advise and sometimes arrange for them to get care somewhere else. So,
Agreed.
yeah, that's really all I have to say about it.
Agreed. We have moved at least one patient and maybe two from Kwon to Sartor. It was really more Sartor having to reach out to grab the patient than Kwon allowing the patient to switch across. But it did happen, right, Len? Wouldn't you say that's a good way to characterize it?
Well, I know that a couple of our guys have switched. I can't recall who, though, at the moment.
Well, one of them is Les.
Oh, he did switch to Sartor. That's right. Oh, I'm sorry, of course.
You were in the appointment.
Yeah, I was. I was part of that appointment.
And
Yeah.
in a little
I'm
bit,
not.
I was just going to say, in a little bit, we might hear from Michael McCabe, who I don't know if you've made that journey down to Madison by now, but he's involved in switching his care a distance
Right.
of quite a few miles, right?
Right. And we'll get to Mike.
I'll leave it by saying it does happen, and it's okay. It's
Yep,
okay to
no,
switch.
we'll definitely get to Michael on that one. But I would say, David, for you right now, it's really important to get to add a GU medical oncologist to your team. If you don't like him, you go back. But I just think it's essential that you have a GU medical oncologist on your team. And if you can't get to Sartor, we've got people who can write letters to Antanarachis for you. if you prefer to go to Chicago, we got people who can write to Dr. Shmulewitz for you or somebody else at University of Chicago. We've got people we can suggest at Northwestern, at Michigan. I'm trying to think where you are in South Dakota, what's relatively close.
Nothing.
Nothing, right.
I mean, Mayo Clinic is 500 miles away from me on it. And I do have a medical oncologist locally, but he's second chair to Kwon.
Yeah, because he's not a GU med onc.
Probably not.
And you've got to have a genitourinary medical oncologist on your team with your type of disease.
You know, I'm not adverse to switching doctors because I had a back surgery in 2021 and I went through 3 surgeons till I found one that seemed competent and I was comfortable with.
Okay. Dr. Jeff, you had your hand up.
Yeah, so I've been an internist for almost 50 years, and I had a urologist managing my advanced cancer. Biggest mistake I ever made. I joined this group and I fired him after he dropped the ball on me 3 times and got myself at Memorial Sloan Kettering, a GU medical oncologist. Best move I ever made. Anybody who sticks with a urologist to manage their advanced disease is foolish. And I was guilty of it, and I was a fool. And now I'm with the right doctor. And I mean, they say a word to the wise.
Thank you, Dr. Jeff. And if I recall, didn't Dr. E tell you the same thing, Alfredo? Something about you weren't getting proper care?
It was controversial, but yes, she had a different opinion. I would agree with that.
Oh boy.
Very
She definitely,
diplomatic.
yes, as the general will tell us, she definitely does have opinions.
Yeah. Marshall,
to me, that's a good thing. I think that, it's difficult for people who are not in this group, who are not near a major medical center, who don't like to read medical stuff, which is difficult to read. I mean, there's a billion barriers for the average person to get top-notch care. And luckily we have this group as an avenue to make it better.
Thank you. Jim, go ahead. Jim Marshall.
Excuse me, David, are you a veteran?
No, I am not.
Okay. I was just curious. Thank you very much.
And the reason Captain Jim is curious is because we have a veterans group. It's not for health navigation. Most of you know, but just in case you don't, Captain Jim leads it and does an amazing job, and it's to help you with your coordinating your health care between the VA and TRICARE and a private system, and also benefits. So that's for the sake of the recording. And Colonel Boykin here frequently attends that group, and I think has found it useful, as does General Blanchette and others.
All right, we're going to move now to Michael McCabe and then Jeremy Liu. Go ahead, Michael.
Yeah, thank you guys. It's just an education to listen here. It really is. And thank you for that. And I did want to say one thing about changing providers, as I talked to my wife about this. as most know here, I left the local regional center and went to UW Carbone Center and under Dr. Lee. And but yet, when my insurance allows it, so I wouldn't be afraid to go to Florida or go wherever. If I needed to, I'm allowed to do it, and I would find a way to make it happen. But anyway, now, as far as a little update, boy, I'm a little tired here. It was a long day, but I'm very happy with what was done, what was accomplished. There's a lot of things that were missed in Green Bay. Um, my treatment has been changed from the one that was causing me so much trouble um, to Orgavix is what I want to say, the daily pill. Has been switched to that. The secondary, I forgot, what do you guys call that? ASI, whatever it's called, you guys. Um, that one will be, which I haven't been getting because I had some trouble with the other one, is going to be changed, and that will be coming soon down the pipeline. Um, as far as
What
the
is
month,
it?
uh,
What's he switching you to?
now, do you mean for the ADT, or do you mean
Yeah, the secondary one.
the
What?
secondary one? Um, I'm not sure on that yet. I will know by tomorrow. And I've already got um, the Orgabex on its way here. It's being special, or what do you call it? Um, specialty pharmacy. Thank you. Specialty pharmacy. So that'll be on its way. I'll update the group as soon as I find that out. So I will find that out tomorrow. As far as mental health, I'm getting like 2 or 3 different referrals that way from down in Madison for counseling, for psychiatry, and all of them deal with prostate cancer, so they know what's going on. I know I'm missing some. What else was that? Oh, also I got a referral to because I know I've been slacking off on my exercise and stuff, and it's called Live Strong, which is like a 3 month um,
Yep.
working out for with a personal trainer for like almost 3 months. So
Yep.
that is exactly what I need. And then I'm also going to have on Zoom monitoring of that and monitoring of everything. Okay, because I need that extra push. Um, my gosh, what else? He did about 5 or 6 referrals, and the urologist that I had um, was worthless. I had some bad troubles. I'll just say that with the local regional one. So that's another referral that'll be coming, and so I'll be getting a lot of phone calls. As I was told, tomorrow and the next day, I'll be getting a lot of referrals. And on my way home from Madison, I already had one call already, and I never had a nutritionist. Never had that, so I will now. So I mean, he dotted every plastic surgeon. Yeah, there's a surgery I need, and that's another one. Um, gosh, I'm probably not covering all the bases, guys. I will have more to add, um, but I just can't believe how quickly he went after that. That this is not right. This is not right. This is not right. Blah 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 blah, and got the ball rolling right away. And I'm very, very, very appreciative, and I felt really good after it. Must have been got an hour and a half at least to get through all this stuff. And but it's just a lot of stuff that was missing and that I need. And geez, I don't know what else I can say. I just that I feel really good about the change that needed to be made and that I finally made it. Yes, it's 2.5, 3 hours away or something like that. But I did also say that I will just go down and I'll stay. They help you with accommodations. If you have
Mhm.
trouble financially, whatever, they'll help with accommodations. So if I need to go down for whatever and be down a week, 2 weeks, then I'll do what I have to do, and they'll help accommodate me with that. So I don't know what else I can say. I mean, Green Bay will be used if I need some blood work or something, to send or whatever. Back down to Madison, whatever. But other than that, not very much will be needed there anymore. So anyway, I do feel a lot better than I felt the last time I talked to you guys about what was all going on, which was a crisis. I mean, there's any doubt about it. And thank you, Rick. Oh, by the way, Rick, okay, I'm going to be tied into a couple more groups, but the one that I got first of all, a referral to was, okay, who's she married to? Gilda Radner. Yeah, I got,
To Gilda's Club.
yes, I did. Yes. So I got,
Okay, great.
and I've got my first meeting coming up Wednesday for that one.
Okay.
And
Well,
then
I gave
also,
the boss at Gilda's Club Madison a heads up that you
yeah,
might be going over there, and she said if you're having any issues to let me know, and we'll straighten it out. But I'm very glad.
yeah. And I filled out my a little registration thing where, a little stuff about me and whatever. And so, yeah. And then he has he's got, with help of his nurse or whatever, there's like at least a couple more. So, I think that's wonderful. I need all the help I can get, but you guys are my primary. Just so you all know, you're my primary. You guys have been just awesome. And to be honest with you guys, I don't know how the hell you put up with me with all that whining and crying and bullshit, but I needed help, I needed help. All across the whole spectrum, I needed help. And I feel like I'm finally getting it, guys. So I'm just
That's what
very
we're
grateful.
here for, Michael.
Yeah, so thank you guys, every one of
Very
you.
good.
And I do want to say one other thing. Now, great day, right? Wonderful. Other than being tired, so what? Oh, by the way, addiction as well was addressed. Rick, I wanted to tell you that.
Oh, good.
Yeah, sometimes there just was so many referrals. I'm so happy. I feel so hopeful. But anyway, I came home with a big, thick letter. I'm going to say this quickly in my mail. And guys may have heard about Social Security numbers being hacked or something. And I believe that's what's happened to me. So there's been a freeze on my bank accounts. So
Um,
I don't know if they could do that with Social Security. I received Social Security. How can they do that? So I was told I need to get an attorney. I need to do whatever.
oh,
There- So that was it was a great day, guys. I'm still very grateful. I'll get an attorney. I'll do what I got to do. But oh my God, I wasn't expecting that. Wasn't
no,
expecting.
no.
So
Well,
anyway, I just end it with that.
how did you
Anyway,
like?
go ahead.
How did you get on personally with Dr. Liu? Was it a
Ex-
good connection?
Yeah, excellent, excellent, excellent.
Okay. We're thrilled. I mean, what can we say, right, Len?
All right, Michael, thank you for the,
Thank you, guys. Thank you.
yeah, thank you for the update. I'm glad you're happy. You're
I'm
happy,
very
we're
happy,
happy. Uh,
except for the Social
okay.
Security number. Anyway, but thank you, guys.
All right.
Okay.
Anybody have
Sure,
anything they
sure.
want to ask Mike or check in with Mike about with his new care program from Carbone in Madison, Wisconsin? Guess not.
Okay.
Okay.
All right. Thank you, guys.
With that, we'll go next to Jeremy Liu. Go ahead, Jeremy.
Hello, guys, and Michael, good luck with everything. Okay. Um, Rick, I think I'll just update you. I'm post prostatectomy about 3 years from UCI. I was reclassified T3A 4+3 post surgery from TC1 or T1C. Sorry, I'm unfamiliar with this terminology, but you guys probably know what it means. T1C, NO, MO, Gleason 4+3. Um, I did pass this along to Keyshawn, Rick, as you recommended, and he actually, in consideration for um, radiation and Orgovix, and trying to determine whether or not I would do the shorter, higher dose course or the lower dose 25-day course or 25 treatment course. He just responded actually, and he said, quote unquote, maybe you understand what he means. That's not necessarily the rationale we use, nor is it the terminology. I presume he means whole pelvic nodal rather than the pelvic girdle. But yes, we consider all this. So I guess they're determining, and Rick, I think we discussed this, whether or not they're going to radiate just the pelvic or prostate bed versus uh, uh, the general pelvic
Right,
region.
right.
Maybe you understand this a little bit more. I don't, but I don't think any decision has been quite made other than it. I think he understands my status post surgery, my Gleason post surgery status. And we've done all the genetic sequencing, color, prostox. Uh, 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 so I think they have a handle on where I'm at. They just don't know where it is yet because my PET scan, most recent PET scan, was negative for any Mets. So the next step that I've been told is to just get more imaging. They want to get an MRI and CT. Part of that is for planning the protocol. So that's kind of where I'm at.
Have
What's
you?
going on with the PSA, Jeremy?
The PSA has stayed relatively stable, between it sort of lingers between 0.16, 0.18, dropped down to 0.17. But again, what Keyshawn said, that's all within the margin of error. It's
Right,
still not,
right.
if I get a regular PSA, it'll obviously round up to 0.2. And he did order that. I got a testosterone. Those results just came back. It's like 466, something like that. Um, and that's pre-Orgovix. I was going to start the Orgovix, but I think, as I may have relayed to Rick, I came down with COVID about a week ago, and just tested negative a few days ago. And from what I understand, though nobody will give me a for sure uh, recommendation, and even that Dr. Keeshan was unaware that there was actually a major interaction on the Orgovix website with
Rev-
Paxlovid.
Yeah, yeah.
So they recommend 2 weeks, um, according to the. Now I didn't talk to the Orgovix people. That's from the Paxlovid people. They said 2 weeks before you start on any type of androgen deprivation therapy.
Yeah, I'm going to put that in next week's reminder, by the way, Jeremy. Thank you for bringing that to our attention last week. And that's definitely what it looks like. And it is only with the pill, it's not with the injectable.
Okay.
So,
Yeah.
yes. Have you reached out to get a copy of that post-surgical pathology report?
I have. I haven't gotten it in yet,
Okay, great.
but I
Because
asked. I did request it.
yeah, I'd be real interested to know where they found the um, the prostate cancer outside of the gland, which is
I
why.
do know. Yeah.
Yeah.
I do know that there was some found, and that's one of the reasons why um, Uchiho is notoriously known being very slow with his robotic surgery, but and it's complicated by the fact that I had hernias repaired at the same time, so I had a 14-hour surgery. But I was told it was because they kept resecting until they got negative margins. And they had to wait in between pathologies to come back before they
Yeah.
could cut again. So that's kind of where it was.
Yeah. So the meaning of that T3A, as I wrote you, is
Yeah.
that there was cancer beyond the gland,
Yes.
but it wasn't in your seminal vesicles. Otherwise, you would have been T3B.
Uh-huh.
So we know where it wasn't, but we don't exactly know where it was.
Right.
And it would be helpful to know where they saw it at the time.
Right.
And we'll move from there. The terminology is a little different in each institution. Mac refers to it as the pelvic girdle, and if you come, this is where we do our plug for PCRI, where Mac Roach will be. If you come to Mac, come to PCRI, you'll hear him talk about the pelvic girdle and not the pelvic nodal Mets. But the big issue here, and there's a bunch of guys on this call who have faced this. If you're T3, you run a risk of what's called micrometastasis, which is metastasis that you can't really see. So Richard Fisk is a good example of that. And so we have to treat an area where we think the cancer could have spread to.
Mm-hmm.
And since they upgraded you from a 3+4 to a 4+3 with T3A, it means that the cancer could have spread to more places than it was originally considered. And going back to my treatment at the time, that's why they radiated the whole pelvic girdle, because they couldn't see it and they just wanted to be conservative. Anybody else who has been faced with as a T3A with radiation decisions would like to speak up? No, don't all shout at once.
I guess no.
No.
That
Sorry,
situation.
yes, sorry for the delay. This was 2013, the radical prostatectomy, so the post-op was T3A, and my urologic surgeon encouraged me to at least consider not having adjuvant radiation, but as we would monitor PSA every 3 months after the surgery, and if and when the PSA rose to 0.3 or higher, then he said, I'm going to send you straight away to oncologist, and you can discuss radiations. Anyway, in my case, the PSA reached the point where I did have to have the initial consult with oncologist and then radiation. Anyway, that happened in let's see, it happened, I think it was in the spring of 2015.
I guess I am just, and we don't give medical advice, as you know, but from what I've seen and for years, I'm just more conservative. And I think that if a man has been through a radical prostatectomy and his disease has come back and he's a T3, why take the risk of limiting the amount of radiation that we do? We've seen too many people who just got limited radiation, just the prostate bed or whatever, and 2 years later they're back in again, and sometimes with nodal mets, and that's really a big concern. So if it were me, I would be more aggressive. Of course, I didn't have surgery because there was too high a likelihood that I would need radiation and hormone therapy anyway. But I just think it makes sense to be more conservative. I have to say. I don't know.
Let me broaden the focus. So at the time of my surgery, I'm only 5'5" and I weighed like 205 pounds. So after about 6 months after the surgery, my primary care read me the Rhinex. Said get a personal trainer. I did. In 5 months, I lost 33 pounds. I learned so much more. If I had gone directly into adjuvant radiation, first of all, I might have seen a personal trainer. I think it would have been more difficult for my body to recover. Of course, I have second thoughts. Was it right? Was it wrong? But okay, so this is now 2024. I actually was able to go from 2021 to 2023, a full 3 years without being on ADT. Rick, I marvel at how comprehensive your knowledge. Correct if I'm wrong, Rick. You are not a medical doctor, is that right? But you obviously are nonetheless. I'm being quite sincere. A true expert, and your encouragement and your ability to laser focus. So I respect what you're saying. The practical standpoint, none of it. What we can't change. We can't change. We make our decisions. We do the best we can. So anyway, I heard I heard the request for somebody who was T3A and the issue of when to have radiation. That was how it played out for me. Thank you.
I just had a question, Gary. Was the radiation treatment that you chose more targeted, or was it more broad, or I don't know what you call the difference between the two, Rick. Wide, a wide target versus a narrow target?
Lou, I think it was the narrower target. I would have to actually read the radiation treatment plan. Again, this was late 2015. This was 38 consecutive business days of IMRT, and I'm pretty sure it was the more to use that generic term, narrow focal, rather than the complete pelvic bed. But please don't take that as gospel. Honestly, I'd have to go back and look. And just for those of you who don't know, so I did, PSA did begin to rise very late last year, and I had 5 days of IMRT, this time at a different radiation center. This was at Georgetown University Hospital. The great Sean Collins, whom I have AnCan and Rick, and many of you in AnCan, but Rick has mentioned Dr. Collins so many times. Because Inova Shar wanted to do 30 days of proton beam. And, I'm not a doctor. I've got...
Let me interrupt you, Gary. We'll come back to you for your story.
Yeah, I'm sorry. Yeah, I don't...
Okay,
I'm sorry. I know, I digress.
Let's stick with Jeremy right now, and then we've got plenty of time. We'll come back to you for your story. Is there anybody else who had to deal with the possibility of micrometastasis at the time of their diagnosis or on recurrence? Don Rogers.
Yeah, hi. I had my prostatectomy in April of 22, and right after it came back T3B N1 MNA, and there was no question that I was going to go for radiation because my post-surgical visit with the surgeon, he set up the appointment with the a radiation oncologist, And I went right in about 2 months later and had 34 sessions of external beam, 68 gray, and to the wide area because I did have a positive lymph node. One of 9 that they took out was positive. And that's it. I mean, I've had suffered some side effects from the radiation. I had a couple of fractures in my sacrum caused by the radiation, and I have a portion of my left femur head, which is necrotic now, and off from the radiation.
Yeah, yeah, but that's
I
a
never heard
different.
that before. Where did you have that radiation?
Yeah, that's different radiation.
All my treatment is at the University of Miami.
I mean, look,
Colin?
that part of that radiation. I mean, they because you had the metastasis in the femur head, they focused on the femur head. That was spot radiation.
No, there was no metastasis to the femur head. The only thing outside of the prostate itself, I had a positive seminal vesicle and at one positive lymph node.
Okay.
So that led to the radiation. And the radiation led to 2 fractures in my sacrum and a necrosis on a portion of my left femur head.
How much radiation did they give you?
34 sessions, 68 gray.
Well, you know, like Len says, it's really unusual. It's really unusual. I can't answer that. I mean, I would say to most men here that, I mean, this is sort of the first I think Len and I are hearing of that type of radiation causing this type of damage. Now, it could be. Are you BRCA positive?
I am not. And I'm seeing an orthopedic oncologist at the University of Miami, and she's following the healing of both my sacrum and whatever happens to the head of the femur.
I don't know. I really, really don't. I just don't know. What about your bone density? How is that?
Bone density has gone down because of the ADT, and I'm on Prolia.
What was your bone density when you started?
Bone density was in the normal range, and it's dropped just into the abnormal range, just into
Okay.
the osteopenia.
Don, it's a that one is it's really interesting, and it's a mystery, and you know, I'd love to know what Belusic has to say about that.
Yeah, I've talked to him about it, and he just defers to the oncologist I'm saying who's a bone specialist.
And does she agree this was caused by the radiation?
Yes.
Who was the radiation oncologist at the University of Miami? Was that Alan Pollack?
No, it was not Alan. I've seen Alan before, but it was his contemporary, his mentor, I mean his mentee, Dr. Abramowitz.
Oh yeah.
Abramowitz came down to join Pollack from Fox Chase.
You got us. Don't know, but I can say that it's. I mean, we've talked to hundreds of men who have had follow-up salvage radiation or adjuvant radiation. The old terminology was adjuvant if you had it within 3 months of your surgery, and salvage if you had it like beyond 8 months of your surgery. Right. And this is the first that we're hearing of this, but that doesn't mean to say it doesn't happen. But it's certainly unusual to us. But can we get back to Jeremy? we keep losing Jeremy on this. Jeremy, what I want to say to you is that what happened to Don is unusual. It really is. I mean, most people getting that type of radiation. I got that type of radiation. I had 25 sessions. I think about 50 odd grays. And I was osteoporotic to boot. Osteoporotic, excuse me, docs, osteoporotic. And I don't think it's done any damage to my bones, but it's everybody's different, right, Mr. Rogers?
Yeah, they are, Rick. I'll get a copy of the couple of reports out to you. You can look at them.
Okay.
Yeah, Jeremy, I wouldn't let that frighten me from getting radiation because, as I have said, we have never heard of anybody getting damage to pelvic bones from radiation. We've been doing so. I've been doing it for 10 years. Rick's been doing it for longer than that. I had 86 gray, 48 sessions for the prostate and pelvic region. I didn't have any damage to any bones.
That's good.
So what's the next step for you, Jeremy?
Well, the one thing I had brought up the spacer, but from what I understand, when you're doing the lower dose, they don't need the spacer. Is that correct?
No, I mean,
No.
Well, you don't have a
Okay.
prostate, right?
Right.
So you don't need the spacer.
Ah, okay. So no Verigel.
well,
Yeah.
Len, I think you need, a spacer is used if they're going
To
to be
also
radiating around the
protect the
rectum.
rectum. Yeah.
Yeah, it's not whether you've got a prostate or not. They still put in, I'm sure there are guys here who have had salvage radiation and they've had a spacer installed. It all depends where the Mets are. It depends on the doc. Some docs don't like to use the spacer, other docs use them. I don't know what to say to you. I didn't get a spacer, but then it was very, very early days. I just don't know what to say. But I'm sure there are guys on this call who have gotten spacers right now who's had salvage radiation and got a spacer. Salvage radiation, meaning after a radical prostatectomy. Anybody? Okay. Well,
I think a lot's going to be determined after I do the imaging studies.
Well, anyway,
Yeah.
you should talk to the radiation oncologist.
Yeah.
No, that's Kishan, Len. It's Dr.
Yeah,
Kishan
Keishan. Yeah.
at UCLA. But that's a tough one. And I hope you can swing it to come up to PCRI, Mr. Liu.
I'm already registered. I'm coming up. I'll be there for
Oh,
your
good.
dinner Friday
Oh,
night.
good.
Yeah.
Oh,
Yeah.
good. With your celebrity friend.
Well, we'll see.
Okay. I'm not a Star Trek fan, so I'm afraid it was lost on me. But some of these guys maybe know who it is. But there's going to be a lot of docs there that you can discuss this with. I will tell you that if you speak to Dr. Roach about it, he'll tell you don't need a spacer. I know what he's going to say. but there's going to be people there, and I'm almost sure that Spacer will have a table there, and some of the other guys who put in spacers. I forget the names of the other products, but they're there. And that's why it's worth coming up, because you go schmooze with them, and then you take that back to your dog.
Okay.
Anybody else have any input on this long discussion where we
Sylvester had some.
Sylvester.
Thank you.
Yeah, Sylvester had news for us.
Well, just a slight announcement. I was frustrated for days attempting to register for the PCRI conference. I kept getting it. I click on the link and I kept getting, I don't remember the exact words, but I get the impression the rooms had been booked. So I got on the phone and attempted to call, and I got some booking agency for Weston. And that young lady said she did not have access to the Weston booking for the price that was quoted on the commercial I got from them. So she wanted to book me in a higher price room at the Weston. And since I declined that, she suggested booking me 1 block away from Weston at another facility. So my niece came over, and somehow by hook or crook, she got into this correct system. And not only did she book me for the 3 days I'm going to be there, but I found out there are different levels of beds that you can book for: queen, king, regular beds. And of course, the fee changes with each uh, booking. And not only that, she got me a couple of days cheaper than the announcement stated. And one other thing, I attempted to call PCRI, and of course, I guess now, if you don't have a cell phone, if you don't have a computer, you are just out there by yourself. What's interesting though, of all of the announcements I've received, not once has any of the announcements stated that if you are a veteran, they waive the fee. Of course, the fee is only $30, but for some of us, $30 means more than 10. So with that, Bill, I hope to see all of you there. And I don't know what room I'll be in. And one other thing too, I get the impression, even if you ask for me, they probably won't tell you the room I'm in, but I don't know. This computer thing is isolating a lot of us.
Well, I've got some. What I want you to do is send a message to Alexa, to Miss Alexa at ancan.org. Okay,
Well,
and
I
tell
have.
it. Okay,
I have.
okay.
In
And are you
fact,
gonna?
but listen, let me state this.
Yeah.
When you first asked for volunteers,
Yeah.
I sent a message on the link to Alexa.
Okay.
A month and a half later, she indicated my message had gone to her, not the regular service, to her, what do you call this? Spam. And last week, I sent another message about my being willing to volunteer.
Yes.
But I have not yet received a reply. So hopefully I'll receive a reply soon.
I'm putting you on my Alexa to-do list for tomorrow, and we'll talk to her and we'll make sure she reaches out to you, okay? And for anybody else, and don't forget the Greek restaurant. Don't forget the Greek restaurant on the Friday night.
I tried that today. But as
Okay.
I told you, I'm not good with computers, and that didn't go through.
No, well, there's nothing to go through on the Greek restaurant. You just got to let Alexa know.
Yep, I clicked on that. But
Oh.
instead of getting Alexis, I got a breakdown of the restaurant offering several different dishes.
Oh, well, there you go. That's about the Greek restaurant. You did get the right site, so don't worry, Sylvester. We got you covered.
Thank you. I need it.
Okay. Okay.
Rick, is that the same restaurant we ate at the last time PCRI was open for business in person?
Well, it depends if you thought the meal was good or not. Did you think that meal was good, Len?
I did. Yes.
Yes, it's the same restaurant.
In other words, you have no idea.
No, it is. I know. It's the Leakies. It's the same restaurant we went to before, twice before.
Yeah, Aliki. Okay.
Okay.
Yeah, so of course, Sylvester, they can't let anyone know what room you're in because it violates privacy, your privacy.
So I don't know how we're going to get together. I'm hoping I see some of your faces and you'll recognize me.
We'll find you, but because you don't have. Do you
Maybe
have a
there's
cell phone? You don't have a cell phone, right?
I have one in the car, so don't ask me the number because I haven't given it out to anybody. I've had the cell phone about 4 years, and I think I've used it twice. I
Okay.
keep it in the car.
All right. I'm gonna tell Miss Alexa that she's got a special task to keep you informed, and we'll figure out how to do it. Okay.
Thank you.
Okay.
Jim Marshall, you had your hand up.
Right, I got a question. Sylvester, what did you book, a bunk bed or a jungle hammock?
The cheapest thing they got.
You're sleeping on the floor.
I did that before.
I know you would.
Oh man.
Thank you.
I can't wait, and I will say I can't wait to give you a hug again, Sylvester. And there's a whole
Looking
bunch of
forward
other
to it.
people. I think Mason would probably agree too. He'll be looking forward to seeing you. Okay.
Well, what a crazy night.
Yeah.
I think we're finished, Rick.
Really?
Thank God.
Well, wait a minute. Gary Z wanted some time. Let's go back to Gary Z.
Oh, I thought he said he didn't, but go ahead, Gary.
Yeah, I did not need time. Thank you.
Oh, okay.
Ah, there you go.
All right. Did you want to finish anything that we cut you off on before? Excuse us.
I don't think so, Rick, because I don't really even remember what it was when I was blabbing on and on. So
don't worry. We all suffer from that.
thank you all very much. Well, you know what? I will just share futuristically. I've changed my teaching schedule around so that starting next month, Tuesday nights will not be a problem. I haven't been able to make it very often so far this calendar year, but I'm looking forward to hopefully being somewhat more regular attendee as I was in the previous couple years.
Okay. Len, would you like to say a few words about Les?
Oh, sure. I'm not sure everybody even knows, but Les Shelder passed away August 5th. I was just recently notified by his wife, Carolyn. He died peacefully at home in at-home hospice. Les was a real gentleman. He was always very gracious and appreciative of any assistance we were able to give him. And as Rick mentioned earlier, we both felt that he wasn't being properly cared for by Dr. Kwon, who once again refused to put him on an androgen receptor blocker until very near the end, when it probably didn't make any difference. But nevertheless, Les was a Gleason 10, and it was really quite surprising that he lasted as long as he did, when you consider that many of those years he was on nothing but ADT. It was amazing that he didn't develop resistance much earlier as a Gleason 10. But yeah, we will miss him. He was a regular. He very often showed up on our calls. There weren't too many times. I would say 90% of the time you knew Les was going to be there. So he really enjoyed the AnCan group and appreciated everybody's assistance. And may he rest in peace. Anything from you, Rick?
Anything from me? I'm just trying to think. I don't think so. I haven't made any notes. Let me just check, and whilst I think about it, is there anybody in the group who doesn't usually want time, but because we're running so far ahead of schedule, which never happens here, maybe it's because the Colonel's sitting next to me and we're going to be able to get out to go for dinner. We're thinking of going across the line. You don't see us. If you don't see us again, you'll know we got stuck in Mexico. But we are thinking about going over the line for dinner tonight. But anybody have anything they want to bring up, or since we're a little early, anybody want to expand on Dr. Alfredo's topic of switching docs? Thoughts on that one?
I'd like to mention something. I was doing a little bit of reading before on osteonecrosis as a complication of radiation therapy, and it is rare, and it does occur. I remember reading about it at one point, and I just reread it. But you're right, Rick, it doesn't happen frequently. It does happen, and it is a complicated situation. And Don should Google it, and he'll find out all about how they deal with it. So I was, very curious about it. And while we were talking, I was Googling it. So it's available, but though you're right, it is rare. It's not common.
Thanks, Jack.
Sure.
Now, David Muslim was on the call earlier on. I don't know if he's dropped off, but he's been spending the last couple of weeks in Maine as well, Dr. Jack.
Yeah, I just looked for him. I think he dropped off.
Yeah.
Oh, well, I'll have to talk to him about that. But I was, where I was a very unique. I've been all over Maine in the past, the usual spots, Booth Bay Harbor and up there in, Cadillac Mountain. This place is so unique, Lake Sebago, and I recommend it for anybody who wants tranquility, beauty, nice cool air, and find a way of getting there. The best way to get there is have a friend with a house. It's a lot easier than finding a reservation.
Yeah, David was in Al Harbor, I think. His boat is he moored his boat up there.
The coast. Yeah. That's nice.
So that's where he was. Jim Marshall, anything you want to say?
Yes,
Larry Fish just came back.
Yes. An announcement on the veterans group starting in September. We are going to go to twice a month, and it's going to be on the first and third Tuesdays in the Schmear room. So that was sent out today within the reminder for the August 22nd on Thursday night, 8 o'clock and where the veterans group meets.
Right.
So we
Right.
are going to go to 2 times a month.
Right. And we will be pushing that vets group at PCRI. So hopefully we'll have we'll pick up a lot of new enlistees. And one other thing, Jim, which I should mention to you, I got sucked into the Zero Inspire prostate group today because I
Okay.
wanted to respond to something, although it seems like the listing had gone. Somebody asked whether Parkinson's disease is associated with advanced prostate cancer, and I do know a couple of situations where it has been. I couldn't find that post, but I found at least two vets asking questions that you have all the answers to. So I told them to look for our vets group on Inspire. But it is sometimes worth monitoring to see what's on that Inspire group, especially with respect to vets.
Okay. The how do I get to it offhand? Is there a link
Well,
to it or what?
Inspire, you want to go to inspire.com, and then from inspire.com, look for the prostate cancer group. I probably have a direct, and then you have to sign up. I probably have a direct link for you. Hold on a minute, let me see. Or maybe Len does. Inspire. Yes, there you go. You know, this is not good because with Colonel Boykin sitting next to me, he's seeing all my secrets here, and he's figuring out how I do all this. He's like figuring out what's behind the scenes, you know.
Um,
And there ain't
another,
much there. It's like the Green Curtain.
right. Another thing, Rick,
Yes.
it will then save me having to write all this stuff I talked to today. I talked to then Alexa, and the thing I'm doing in here, I will be going to the Fort Belvoir Retiree Appreciation Day and the Fort Myer Appreciation Day, and I'm also giving a pitch at the local American Legion on September the 14th. And I wanted to not only do my group, but to do essentially AnCan as a whole, to put out
Okay.
all of the stuff it then offers.
Okay.
So
Well, you
I
work with.
contacted her, and we are going to get some stuff
That's
together.
very good. And
Flyers.
if you need any support for any of this, maybe I can twist the Colonel's arm a little bit to help you since
Well,
he's with me tonight.
I might be asking in the veterans group for some folks around here to assist in this. At least have
Okay.
2 of us. It's easier than a single person. So anyway, that's the news from Lake Wobegon in the nation's capital here.
Oh, I thought that's where Dr. Jack was. Okay. Anybody else got anything tonight? Last call? Or can we actually finish 10 minutes early? 10 minutes
Well,
early, Len. You
I
get
want
a
to
gold
ask
star.
Larry.
Are you
Yeah,
meeting on September 2nd?
I'll take it. But Larry Fish came back. He was off and he came back.
Yeah, we saw it for a little bit.
Did you
But I
have
didn't have
anything, Larry?
no, thank you, Len.
Okay, well, and
Oh, okay,
we'll
fine.
talk. We'll
Well,
talk
then in
about.
that case, I'll say good night.
Hold on, somebody just put a hand up. Hold on, David Opp. Yes, Mr. Opp.
Dave,
Yes.
go
Are you
ahead.
meeting again on September 2nd?
Okay,
Oh,
let
right.
me just. I'm glad you put your hand up. Do we have your email address?
No.
Would you either like to put it in the chat window or send it to me and we will enlist you on the reminder, and you'll get a reminder before every group. We meet every week. in the first 4 weeks. So our next meeting will be on the 27th of next month. But please give us your email, and then you'll get a reminder.
Rick, he's
Okay?
asking about Labor Day. He's asking about Labor Day on the 2nd.
Oh, Labor Day, yes. We'll be meeting. We'll be meeting on the evening of Labor Day.
Okay.
You know, we're like the U.S. Post Office. What do they say? Hail, rain, snow, nothing stops us. Was it cool?
Yeah.
You meant to say 27th next week. You said next
Yes,
month.
next week.
Yeah.
Yes,
Next
that's right.
That's at
Thank
3
you.
6 o'clock. 6
3
o'clock, not 8 o'clock.
o'clock Eastern.
Okay. Thank you, David. I'm writing that down, and may I also mention that if you're interested, we have a group called Men Speaking Freely, which allows you to talk about everything and anything except your treatment, and it's for everybody. It's not just for prostate cancer. If you're interested, you can get a reminder for that too. Are you interested? Thumbs up or
Probably
thumbs
not.
down? Probably
We'll
not.
see.
That's just fine. That's just fine. That's just fine. Okay.
Thank you, everyone.
Good night.
Thank you. Good night. Good night. Good
Thank
night.
you, Len.
Wrap it
Thanks,
up
Len.
tonight.
Thanks,
We'll see you
everyone.
next week, guys.
Thanks, everybody. Good night.
Good job, Len.
Thanks, Night. Thank you.